Alicia, thank you so much for that. I did want to let everyone know that I know sometimes it's difficult to put questions in a Q&A when you're talking about mental health. So we did want to tell you that if you did want to ask a question and maybe did not want everyone on the panel to know, you could put it in the chat to CE team member, and tomorrow morning we will address your questions, and Rachel and Alicia will be available to answer them. So if you did want a little bit of anonymity on that, we do have that option for you. And we really want to thank them for doing that wonderful talk, because it is something that's very important. And I know we're getting to the end. I hope everyone's doing a stretch. I know we've talked about some heavy stuff right after lunch, and everybody might be a little filled with amitriptyline or something like that, but we want to go ahead and move into a really important topic, which is healthy living with sickle cell disease. And I would like to introduce my colleague, Micah Furlis, who is our acute care nurse, inpatient nurse practitioner with our sickle cell medical home, who obtained her Master's of Nursing from VCU in 2008. She works primarily inpatient and in the emergency department to provide medical consultations, continuity of care, pain management, and coordination of care for adult sickle cell populations at our healthcare system. She has an extensive experience in internal medicine, acute care, emergency medicine, and primary care, as well, of course, of working with our population. Micah, thank you for being with us today, and I'm going to turn that over to you.
Hi, everyone. I'm really happy to be here. I am going to talk to you guys about healthy living with sickle cell, so we will go ahead and get started. Okay. So just a quick overview. We're going to talk about healthy lifestyle. We're going to talk about complications of sickle cell disease, and then maintenance and prevention. We do have a polling question for you all. And reminder to respond to the polls, please use either the website pollev.com /VCU Health CME or text VCU Health CME to 22333 to answer the polls. And the first question is, sickle cell patients often complain of not being able to gain weight. What is the best way to effectively gain weight if you have sickle cell disease? This is not a multiple choice. This is one of the ones you can type in your answers. So you guys are welcome to participate as you feel like you can and want to. Okay, I see some answers coming in. Thanks, guys. So you guys can kind of see this evolving on the screen. One of the predominant ones is protein and diet and healthy. Good answers. So yes, we will cover not specifically weight gain, but healthy eating in this talk. So nicely done. All right, we can move to the second polling question. Sickle cell patients and family often fear vaccines. What is the best way to empower and educate patients and family members about preventative medicine, including vaccines? This is another word cloud. You guys can type in your thoughts. One word or hyphenated words I think are preferred. Otherwise, I think it takes the first word that you type in. Education is popping up as top on the list. We see some trust. Very, very good. Community. Education seems to be the predominating idea on this one, which is very true. Preventative medicine is all about education, discussion, and patient empowerment. All right, we're going to move on. We're a little behind today, I apologize. So I want to talk about Arden, not an actual patient. He is a 37-year-old African-American male with a history of hemoglobin S beta 0. He's had acute chest twice in the last year. He has alloantibodies that really inhibit our ability to transfuse him. He has a new ACE inhibitor for proteinuria, which is indicative of impending kidney disease or already present kidney disease. As an outpatient, he has stopped hydroxyurea many years ago because he couldn't adhere to the lab schedule. He's a traveling consultant with 2 young young kids. He rarely takes opiates. He has to drive a lot for work, and he's got primary custody of his 2 young children. In clinic, he admits to worsening fatigue, worsening stamina, aging, poor memory, especially about taking medications. He worries about his activity level and nutrition due to his busy schedule and his children's schedules, and he can't get red cell exchanges like his best friend who gets him for stroke prevention. So he wants to know what his options are for feeling better. So throughout this talk, we're going to give you a couple of different things working with sickle cell patients that you can bring to Arden. So for healthy living, you need a plan to eat healthy. This may include diet, this may include macro counting, this may include just having an idea of what a healthy plate looks like. Fitting in regular physical activity, it does not have to be strenuous. Trying to maintain a healthy weight. Obesity puts extra pressure on the joints, and being undernourished can cause some damage to the body as well. And then stopping smoking and minimizing alcohol consumption. Notice I didn't say you can never have a drink or 2. So healthy eating and vitamin D. Vitamin D is one of our nation's most common nutritional deficits. It is very prevalent in our sickle cell patients. A well-balanced, well-diverse meal from day to day, from week to week to month will help with that, although many of our patients actually do require vitamin D supplements. You need about 40% protein, 40% fruits and vegetables, which are your complex carbohydrates, and then about 20% fat. Our sickle cell patients who have low vitamin D levels report more crisis-related visits. This is why we often check vitamin D levels in clinic and request that you take supplementation, It has anti-inflammatory effects. It improves your immune response. You can get over infections better. And then it regulates your calcium uptake so that you have stronger bones, less likely to get osteoporosis, as you guys are already high, or as they are already high risk for things like avascular necrosis. So some examples of foods rich in vitamin D: fish, eggs, milk, cheese. Broccoli should be on this list, as well as some of our darker green leafy vegetables. You can Google that. It's pretty easy to find. And then your higher fat foods, so your red meats, your high processed foods with lots of sugar and salt are not great for balancing out your macros. Some ideas of what a healthy plate looks like. Now, everybody's nutritional guidelines are going to be a little bit different based on where you are with your age, your weight, your reproductive history, things like that. But healthyplate.gov is a good place to start as far as balancing your macros. There are tons of other nutritional websites out there. I'm not going to list them out for you, but American Heart Association has some good ideas if you're worried about hypertension or some of those other things. Serving size. Now, again, these are average for the general population. You can do the calculation based on your weight and calorie needs, but 2 to 3 cups of vegetables a day, 1 to 2 cups of fruit a day, 5 to 8 ounces of grain a day. It's not a very big portion. Dairy, some people need it, some people don't, but 2 to 3 cups is the maximum recommended, fat-free or low-fat. Protein. You can get a really good idea of your protein needs if you know how much you weigh. So if you take your weight and you multiply it by 0.36, that gives you how many grams a day of protein you should be aiming for. But if you prefer to weigh 5 to 6.5 ounces if you have a scale. And then oils is very limited as well. About 6 teaspoons a day would be the maximum recommended. As far as physical activity, it is very important for sickle cell patients to get in some physical activity. Low to moderate exercise is what is recommended. It helps with your cardiovascular health. It helps with muscle maintenance. It helps as a distraction from chronic pain, as long as you don't overdo it and cause acute pain. Healthy weight maintenance, improved joint health, which goes hand in hand with weight maintenance. And then it's a really good habit for your mental health. Lots of my patients tell me that when they can just get out in the neighborhood and take a walk, they feel better. With that activity comes hydration, and in general, sickle cell patients have a higher hydration needs than the average person. Patients need to do this to keep their cells hydrated. It will help reduce some of the sickling. 96 ounces or 12 glasses a day is the minimum recommendation, and at least 64 of those should be water. There are some calculations that take you guys up to, or sickle cell patients up to 128 ounces, which is a gallon. Caffeine can actually make things worse, so try to limit coffee, tea, and sodas for hydration purposes. Obviously, we don't want anybody to go through caffeine withdrawal. Water, electrolyte solutions are good, Gatorade, Powerade, but again, excessive amounts of sugar, so juices, sodas, teas, and coffees if they're not made, carefully. But balance is important. So when we're talking about healthy lifestyle, just a reminder that sickle cell disease impacts every single organ in your body. Everywhere you have blood, you can sickle. So this is just another version of a diagram you guys have seen earlier in this conference, and maintaining a healthy lifestyle can help minimize or prevent some of these complications. So we're going to start at the top with the brain. Your brain is your greatest weapon. Connect it to your heart and you can go anywhere. So we're going to talk a little bit about brain health and particularly stroke screening. Strokes are the most common complication in sickle cells, although they're not the most deadly at this point. The new ASH guidelines do recommend at least a one-time screening MRI. This comes up in clinic a lot. It helps us kind of determine where you are as far as your risk factors and whether we need to do any additional studies or screening. Patients get really freaked out when we talk about MRIs because they don't know what it is and what it does, and it's loud and you're in a tight tube. So I like to show them diagrams very similar to this one. All they have to do is lay there. They can relax. It takes about 45 minutes for the study. We're just looking at the tiny vessels in the brain, the structures of the brain, trying to get an idea of whether sickle cell has caused a lot of damage up there and what we can do to minimize future impact. This picture we'll go over briefly is it's an example of blood flow analysis. This is what our doctors and our radiologists are looking at when they're reviewing these MRIs to figure out where the sickle cell has impacted and whether we need to do additional studies or maintenance or change up our treatment plan, et cetera. So how do you prevent a stroke in a patient with sickle cell? Healthy eating, regular physical activity, stop smoking, minimal alcohol. I won't say total cessation, but minimal is better. Hydrating, disease modifiers, and keeping everything else well controlled. Just because they have sickle cell doesn't mean they're not at risk for diabetes, hypertension, high cholesterol, all of which can cause strokes. While we talk about the brain, I do like to touch a little bit on mental health. I know this has been covered a lot today, but it is important for a healthy lifestyle. There are tons of factors that come into play to formulate a balance when it comes to mental health and healthy living, particularly stress and sleep. So, sleeping. Lots of our patients have reverse sleep-wake cycles. They like to stay up all night, sleep all day. Whatever their schedule is, it's just better to stay on it. Trying to get about 8 hours a night, be careful with your naps, your exercising will help, don't drink your caffeine too late. The usual stuff. There are over-the-counter sleep aids that we can use occasionally, sleep timing, cooler bedroom, try to unwind. These are all things that we've talked about with our own providers and that we can talk about with our sickle cell patients. Stress. There's emotional signs of stress and physical signs of stress. Headache, back pain, difficulty sleeping, depression, anxiety, irritability. Offering social support. So church groups, volunteering, jobs, therapy or counseling, family, friends, chaplain, etc. Next up is the eyes. The eyes have one language everywhere. So what happens in the eyes? Hemorrhage, ischemia, injury to the retina, and blindness. We do recommend routine eye exams, most important with your SC, and it must be a dilated eye exam. They want to look in the back of that eye. Encourage dental care. They are just at risk or even more for things like dental infections, gum disease, cavities, abscesses. These are painful. And any of our patients who are on higher doses of opiates tend to have a higher risk. So they need to go to the dentist just like everyone else, and trying to just kind of remind them that you have to go to the dentist. They will often ask for things like antibiotics prior to dental procedures. This is still a pretty common practice, so they can check with their sickle cell provider first, but prevention is always better than fixing stuff. Jumping down to the heart and the vascular system, hypertension causes 13% of deaths worldwide. This is outside of sickle cell disease. So in clinic, they will get their blood pressure taken. We will be checking it and trying to make sure we're not missing hypertension, hypercholesterol, high glucose, and then weight and BMI. So one of the ways we check on the cardiovascular system is called an echocardiogram. This really tests the action of the heart using an ultrasound. So the wand goes over the chest with some cold jelly, and they take some pictures of the heart. We use it to kind of monitor for things like heart failure. We can see early signs of pulmonary hypertension. That's our big player with an echo. And then whether some of these interventions with lifestyle changes can help us prevent worsening damage in addition to the sickle cell. So if your heart is starting to have issues because your blood pressure is too high, then we got to work on that. So sickle cell providers will often order these. We do them a lot inpatient as well, just to kind of check on what's going on in there to make sure we're not missing anything. Also, with the vascular system, we talk about clotting. Sickle cell patients are at a very high risk for clots anyway. They're hypercoagulable. That vessel lining is dysfunctional from all the sickling, and there's lots of stasis from sickling. They also have an altered red cell structure. So this promotes hemolysis and the release of all these irritating things into the lining or into the blood vessel. This activates the coagulation cascade, and then they vasoconstrict. There's reduced flow. They can't break down that juncture of all those cells and I mean all the cells, the red cells, the white cells, and that causes ischemia and vascular injury. There's also a predominantly low circulation of protein CNS due to consumption. So this messes with how the coagulation cascade kind of continues on. So it can be hard to stop. So preventing a clot is super important when we can. So how do we do that? Reduce your risk by hydrating, eating well, stress reduction, disease modifiers, huge help with this. And then if you are recommended to have antiplatelet or anticoagulation therapy, so blood thinners or things that make your platelets less sticky, if you've had a stroke in particular, we ask that you continue those until you're told otherwise. Hopping on down to the lungs. This is just another version of a chest x-ray. I wanted to kind of show what we're looking at in a chest x-ray. I know you've seen a couple this conference, but these are fairly normal lungs here. Nice, big, inflated lungs. We are going to recommend pneumococcal vaccination. This is where we look at that baseline echocardiogram. A lot of sickle cell patients will get a chest x-ray when they come in, particularly if they're complaining of chest pains. We have lots of chest x-rays on our patients. And just compare and contrast. How do those lungs look compared to last time? We might also recommend the COVID and the flu vaccine, depending on the time of year. We do ask that they stop smoking. Smoking is bad for everybody, not just people with sickle cell, but we already have so many players or cooks in the kitchen, if you will. This is just another thing that will insult those lungs and cause damage over time. Kidneys. We are starting to screen more for early signs of kidney damage, so protein in the urine. And then depending on what those labs show, so they'll ask for blood studies and urine studies, kind of depending on what those look like, they may, ASH is recommending certain medical therapy be initiated for certain patients, depending on how high those levels are and how chronically, we may not do it on the first check, it may be the third check, depending on, what it looks like. They also are asking that we refer to nephrology, which is a little bit harder to get patients to go to yet another specialist. But the takeaway is we ask patients to come to their appointments and get their labs checked because we don't want to miss something like this. This is something we can catch early. Endocrine disorders. So remember I said sickle cell affects everything head to toe. If you have blood there, it can be affected. So these can cause growth delays, trouble with sexual organ function and development, as well as osteopenia, which is where that bone marrow and that bone starts to kind of degrade over time. This can also trickle into cognitive defects, so processing delays, impaired executive function. So this is why we talk about certain times we worry about why a patient with sickle cell disease can't remember that new task they were supposed to do, why a handful of them have trouble with impulse control even as adults, new memory, so why they can't remember to take that new medication like we talked about or like we wrote down and gave them a chart, and planning and organizing. These can be very, very tricky things depending on, the endocrine part that may have been damaged, and then, again, silent strokes. So impaired blood flow, hypoxia, and then strokes that we just didn't know they may have had at some point. Other health recommendations. We really do recommend a primary care doctor. We know that they see us often and that we tend to kind of fill some of that void, but a primary care doctor, their job is to look at all this other stuff with us. We work together. So making sure that some of that screening that needs to be done is done, colonoscopies, I think there's another slide that talks about important screenings, and women, they need an OBGYN. It is very important to get routine testing, routine PAPs, and then talking about pregnancy before they actually get pregnant would be phenomenal. Oh, so here it is. Colon cancer screening, depression screening, osteoporosis screening, mammograms, cancer screening, prostate cancer, and then diabetes screening. Sometimes we, don't get all the studies we need. Just a visual of healthy bone versus osteoporosis, and then references. I really appreciate everyone for being here for the talk. I am told that there are not any questions. Thank you so much for participating with us today, and we're going to go to a break.